So Representative Ryer is going to move that House File 3529 be re-referred to the Committee on Commerce, Finance, and Policy. There's an author's amendment to put the bill in its intended form for discussion. So Representative Ryer moves the A1. Is that correct, Representative Ryer? And so all in favor of the A1 amendment, please say aye.
Aye.
Aye. Opposed? Motion prevails. The amendment is adopted. To your bill as amended.
Thank you, Madam Chair, members. I appreciate the opportunity to present House File 3529, which requires health maintenance organizations, HMOs, in Minnesota to be nonprofit. This legislation restores a standard that was changed in 2017 and will return the industry to a more patient and provider-centered focus. The bill is straightforward. It updates 6 sections of Chapter 62D to require that HMOs must be a nonprofit corporation organized in Minnesota or a local government unit instead of a foreign or domestic corporation or local government unit as written in current law. It also includes a new section, Section 7, that outlines a transition plan for HMO business currently operated by for-profit HMOs. The transition is scheduled to be complete by December 31st, 2025. There are fundamental differences between for-profit and nonprofit health plans that drive the need for this bill. The key, though, is who the organization exists to benefit. The nonprofit plans in Minnesota have historically been charged with looking out for the health of Minnesotans. A general definition of nonprofit says it well. A nonprofit corporation's purpose and activities must serve the organization's mission to benefit the public and may not be operated to profit other persons or entities. In contrast, the responsibility of for-profit organizations is to shareholders and the delivery of financial results that satisfy market expectations. When we changed this law in 2017, concerns were raised that nonprofit plans would be at a disadvantage. In fact, there were bipartisan comments that making sure that nonprofits could compete fairly was important. Now in 2024, we see that the playing field is not level. For example, for-profit companies are advantaged by having broader portfolios and being able to hold on to more assets. For-profit plans' market position in Minnesota is limited right now, so it's time to act. We've seen the outcomes of industry consolidation in the healthcare system and other markets. It has led to higher prices and lower quality. We need only look at the performance differences in the Medicare Advantage program between for-profit and nonprofit HMOs. We're in the position now to protect the longer-term well-being of our healthcare system by halting the growth of for-profit plans in Minnesota. In closing, I ask for your support for this bill as we seek to improve our healthcare system to ensure that all Minnesotans have ready access to affordable, high-quality health care. Thank you.
Thank you, Representative Ryer. Is there anyone in the room who wants to testify for or against the bill? Welcome to the committee.
Thank you, Madam Chair, Representative Ryer, and members. Michelle Benson with the Health Plan Partnership of Minnesota. Our members include Cigna, Allina Health, and United Healthcare. I appreciate this opportunity. Last year, the legislature requested a report on HMO conversion. This report was to be released in 2 parts. February of 2024, we received a preliminary report, and the remainder will be available in June of 2022. If Minnesota were to return, if this bill passes, Minnesota would return to its pre-2017 status, being an outlier by being the only state that doesn't allow for-profit HMOs. The report states clearly that right now the information is inconclusive. If you turn to the executive summary, it states minimal data are available to shed light on whether differences exist between nonprofit and for-profit HMOs with regard to day-to-day operation, enrollee satisfaction, or quality of care. Those aren't my words. Those are the words from a report that this committee requested. All HMOs, regardless of status, are subject to oversight by both the Department of Health and the Department of Commerce. There are no exceptions. All HMOs, regardless of status, are subject to a medical loss ratio. All HMOs must compete for enrollees by having strong provider networks, competitive rates, and satisfying the people they serve. Consumers and employers are free to choose the best value they find in options for coverage. No HMO can charge more or provide less because they would simply not be chosen, regardless of their status as for-profit or nonprofit. HMOs, regardless of status, are subject to medical loss ratios at both the federal and state levels. Any excess funds are required by law to be returned to enrollees. Additionally, the Minnesota Department of Health gathers vast amounts of information reported on an A1 report to ensure that only allowed expenses are included to be charged out in our public programs. I'll send members a copy of this report later. I didn't bring it with me here today because, well, I'm an accountant and I might find it fascinating. What you really need to take from it is that there's extensive reporting regardless of your status, whether you're a for-profit or a nonprofit. The playing field is level between these two types of entities. Many of you will remember.
I'm going to ask you to wrap up, please.
Oh, sorry. Many of you will remember a few years ago when a plan exited the market and the chaos that caused for medical assistance enrollees. Removing options from the market will result in that same chaos. And HMOs, regardless of status, are part of complex organizations. Again, Appendix C will show you how complex even nonprofit HMOs are in their organizations. The report coming in June will shed more light. And I believe in that report, you will note insignificant differences between for-profit and nonprofit HMOs. The Health Plan
All right,
Partnership
I
of
really need
Minnesota
you to wrap up, please.
is opposed to Health File 3529 as we are community partners, employers, and are dedicated to giving value to our enrollees. Thank you, Madam Chair, for letting me go over time. Good
Representative Ryer, any final word?
Thank you, Madam Chair. I think that the input that many of us receive from our constituents about concerns with the performance that they've received speaks for itself, and I ask for your support.
All right, with that, Representative Ryer renews her motion.
Wait, Matt, are we
Oh,
going to
well,
bring this
no
back
one-
for discussion?
Well, I'm sorry, I didn't see your hand, Representative Brindley. I was kind of looking at the list and didn't see anyone on it. So Representative Brindley.
Thank you, Madam Chair. I can't imagine that I'm the only one who wants to ask some questions about this. I've got a couple of questions.
Benson,
One,
you can sit down. Thank
Madam
you.
Chair, thank you.
And you know, my questions revolve around a lot of the things that were said. Representative Ryer, you said that they've resulted in higher prices and lower quality. There's even some stuff in the language of the bill that's questionable as far as that goes. So my question is, there is extensive reporting. So I get anecdotally you have people who have talked to you and said that they're not happy with it, but I'm wondering if you can point me to the data that shows the differences between the nonprofits and the for-profits and how they are functioning in Minnesota.
Representative Ryer.
Thank you, Madam Chair. Thank you, Representative New Brindley. I will send you references to abundant reporting from KFF and other organizations, academic journals that have documented the impact of this transition to for-profit health plans.
Representative Brindley.
Thank you, Madam Chair. And I would very much appreciate seeing that supporting data because right now we're not seeing it, and we certainly have not seen it from our own departments here in Minnesota. And so I do think that this is premature. We don't have that data here in Minnesota. While extensive reporting is happening, and so I guess I know we're out of time, but there are just, it seems odd that we would cause this disruption in the system when we literally do not know what's happening in the state of Minnesota. We don't know. And in fact, I mean, is Representative Bierman in this committee? Oh, yes, exactly. We were on a panel together. And I actually said, we should have data on things like claim denials and things like this so that we know, is it more extensive in the for-profit plans? Because that would be problematic, obviously, for our constituents. But we don't have that. We don't have that. And so I'm not sure why we are eliminating competition. I would also just say, going back to, we held an extensive hearing on managed care before session, and literally one of the testifiers who probably was certainly most in favor of eliminating managed care organizations also said there really isn't a difference in not-for-profit or for-profit. So this is, I mean, I get that there is a personal, and not you personally, but there is a personal bias against for-profit companies. But this just seems to be exclusively punishment, not based on data, which I think is problematic. Thank you, Madam Chair.
All right, Representative Nadeau and then Schumacher.
Thank you, Madam Chair, and thank you, Representative Ryer. And this is I think this is an important topic that we're talking about. We all feel better in Minnesota because we have so many options with nonprofits. I mean, not only in healthcare delivery, but also our direct service providers for disabled communities and all the other people that we deliver services for. And I happen to have for-profit and nonprofit direct service providers that I work with at the county, and they meet all the same standards. They are required to meet all the same reporting requirements. They deliver the same services. Probably 10 or maybe 15% of my providers are for-profit. It's dominated by nonprofits. And we feel good about that. And I want to make sure that far too often we end up, our feelings end up displacing and dispelling science. And Representative New Brindley is right. There isn't data to support eliminating an option for people. I mean, if we're going to be here and say 49 states are wrong, and we're the only ones, and we're Minnesota, and we're going to do this better, and we're going to get rid of this, I hope that we would make that decision based on data and science rather than the belief that, for-profit corporations are bad. They're not bad. I was just at a fundraiser the other day, and there was a bunch of, and this was for disabled service provision. And the greatest people in the room were the corporations that were standing up there and giving money to provide services. They're not bad. They're not bad. And so if there's data and if there's evidence, and the Kaiser reports that you're going to send, maybe those are national studies. There is no study in Minnesota that will defend getting rid of for-profit healthcare providers, and they're serving 40,000 people in Minnesota. That's it. Small percentage. So I just hope that if this continues, if it's laid over, if you continue to work on it, that we really make decisions based on data. And that's it. And I will be right there with you. I'll be arm in arm. And if there's a reduction in service, if denials are higher, we can address those things, and I'll be right there. But right now, I just think this is premature until we get the rest of the studies done. So thank you.
Representative Schumacher.
Thank you, Madam Chair. And my first question is about the testimony that was submitted on the comprehensive one, the link on the website, pages 4 and 5. There's 2 pages of written testimony, but there's no name attached to that or any organization. Could we get some light shed on that, on who that?
Okay, Mr. Sandy's going to check on that. So why don't you ask your second question, Representative Schumacher? Is that the question?
Madam Chair. That was my only question. I was just going to also make the point that there's been discussion in this hearing today about the transition to for-profits, but there really isn't any discussion about conversions in the bill. There's transitioning of closing or eliminating the for-profit, but no transition from not-for-profit to for-profit, which I think is maybe getting muddled in the conversation today. Thank you, Madam Chair.
Thank you. Oh, so Representative Schumacher, this staff here will, if it's okay with you, will talk with you offline about that issue. 'Cause there might be some misunderstanding about that. Okay, so I don't know if, it's talking about conversion, and we need to get wrapped up here, but I don't know if, well, Representative Breyer, what I'm going to do is just let you have the last word and go ahead and address that in your closing comment.
Thank you, Madam Chair. Yeah, this is not a bill about the whole conversion matter. There's a whole nother bill about that, I believe. But this is about laying out a pathway so that people who are doing business in Minnesota with the permission of Minnesota have a clear pathway, and the members have a clear pathway to know what's going to happen so that it isn't a sudden disruptive change. I would point out that now is exactly the time to do it because there isn't a great deal of business and there are fewer people to disrupt. And I also just want to close by saying this is much, much more discussion than this issue had in 2017 when we changed the law so that for-profit plans could enter the market. Thank you, Madam Chair.
Thank you. So with that, Representative Breyer renews her motion that House File 3529 as amended be re-referred to the Committee on Commerce, Finance, and Policy. All in favor, please say aye. Aye. All opposed? No. The motion prevails. The bill is on its way to Commerce.